Welcome to this edition of Insights with Ovationz. I'm Aaron Ellis, your host. You can find me at aaronellisofficial.com, as well as my social media is all Aaron Ellis Official. Today, I am joined with Miriam Zylberglait, or also known as Dr. Z. So if you missed the last name, just remember Dr. Z, and we're all on the same page that way. Miriam or Dr. Z is a triple board certified physician in internal medicine, geriatrics, and obesity medicine. She is a best-selling award-winning author and the founder of Virtual Wellbeing MD. Now, in her pursuit of her dream to help others achieve lives full of joy and meaning, she focuses on well-being, burnout, mental health, and leadership development in a comprehensive, holistic, personalized way. I'm excited to dive in with you, Miriam. Welcome.
Nice to be here. Thank you so much for inviting me.
Yeah, so we have about 20 minutes here. I like to cover a lot of things. I'm big on the personal and professional and understanding that's not separate. So I would love to hear what's led you to what you're doing today. Like personally, what has actually led you to actually becoming Dr. Z and the Virtual Wellbeing MD?
Well, the story about how I became Dr. C probably is more simple, and I wanted to help people. I decided to go to medical school, and I became a doctor. I transferred myself from Peru, where I grew up, and where I practiced as a physician for 10 years for the Navy, to Miami, following the love of my life. So I came here 12 years ago. I got married, and suddenly two boys came to my life at the same time that I was redoing my practice here and getting my certifications here. But I believe that that's the most normal story, with some extras, but it's a normal story. I believe that what is more interesting for myself, or is surprising for me, is how I transform in the person that I am today. This well-being advocate, the writer of a book, the owner of a business, right? Very non-expected. It was not part of my plan. I remember being in the hospital when I was still working for the healthcare system during COVID, and realizing that a female doctor, mother, died by suicide. And I got very shocked. And I got very surprised too. I truly, at that point of my life, I didn't know that this was happening, that this was not a lonely, unique event. I got curious for some reason, and probably because I asked myself why this happened to her. I mean, she is almost my age. She is as successful, or she was as successful as I was. She has two kids waiting for her, and a husband. Like, it's the perfect, picture of someone that should be happy. Why this happened to her, and why this will never happen to me. And I started doing some research, and what I discovered is that burnout was more frequent than what I knew. Right now, 65% of physicians suffer from burnout, 60% suffer from clinical depression, and 400 die by suicide every year in the United States.
Physicians? This is physicians?
Oh, physicians. Wow. Nurses, the number is around 800. And these numbers are coming from before COVID. So this is not because of COVID. This was already happening. Something that I was absolutely unaware, not only because I was an immigrant and I didn't grow up in this country, and I was maybe not so aware, but when I started to talk with other physicians, they were absolutely lost. They didn't know that this was happening. They didn't know the magnitude of this. And they didn't know how severe burnout was, and how many of us we were affected. And it was a very, very difficult pill to swallow for me at many levels. And since that day, I was not able to stop. I redirected my life. I started to learn new things. I started to be more proactive. And finally, I left the healthcare system, the structural healthcare system, to create my own system, because I lost my fight against the system. So I am now trying to create a new system for others and to prevent these things to happen to others.
I think I want to put introduce a thread in what I just heard you say. So we talked about where you come from and what's gotten you to where you are today, and you talked about you're doing things that you never thought you would do. They weren't part of your plan. Part of that, though, then we went into this moment or this period of time where you got this research, you started to learn some of these statistics and what was really going on, and then you said, from then on, I haven't stopped. And what I see in that, from my experience, what I see in what you're saying, like the underlying essence is that you literally found something that got a hold of you, something that inspired you. I'm getting chills on this. Inspired you, which ultimately it's taking you to completion, right? It's not a motivational factor. And with that, of course, you're doing things you never thought you'd do, because it's that inner guide that just starts taking you, you grab on and you follow it. So that was a beautiful way that you put all those things together, or the way that I just shared how I put them together too, right?
Yeah,
what I would really love to hear, because especially in the last year or so, the word burnout has been thrown around a lot. And, I've been I've been speaking, like I said, I've been working with corporations and everything, but I've also done a lot of marketing and building companies and stuff like that. And I always see when somebody takes a hold of a trend, right? And they don't necessarily even know what they're talking about. So I always love to talk to somebody who's technically an expert in these areas and hear and have the audience hear what actual burnout really is, rather than just what they've heard or what they see on their social media feeds. What could you tell us about burnout?
So the first thing that I want to mention is that majority of physicians, those that are more proactive, trying to prevent this burnout to happen and trying to improve the healthcare system, will not use the word burnout. They will use the word moral injury.
Moral injury, is that what you said?
And that has a reason. First of all, burnout was created as a term decades ago, right? This is not new. This was created in the 1970s and was a description of someone that is tired, fatigued, not working at the level, right? Being not motivated. Some use the word that they act in a cynic way as a result of being, overwhelmed at work. Mm-hmm. And that's kind of the beginning of the term burnout. Today, burnout really applies to everyone and everybody in different ways. We have even parental burnout, right? Entrepreneurship burnout. So burnout is right now a word that we use almost comparing it with fatigue, right? Or overwhelmed. So for me, it has been very diluted, which is a problem. The second part of this is that just a couple of years ago, the ICD-11, which is the list of conditions, medical conditions that we use to diagnose people, incorporate burnout as a medical condition, which has ramifications, because right now, if someone labels you with burnout, that kind of goes as a medical condition that could be even a reason for disability, could be a label for mental health problems, and will have a tail after that, right? That we don't know yet. This is something new, but we will see a tail of after that change. Moral injury is very different from that. And moral injury separates you as being sick because you are not good enough, because you got tired, because you don't have your energies, or because you are not enough motivated, or not smart enough, or not capable enough, to having all these symptoms as the result of being pushed to do things that are not a normal expectation.
Yeah.
When you ask a doctor or a nurse or anyone, could be a lawyer, to work for 60 hours non-stop, to see 45, 70, I heard recently an ophthalmologist seeing 75 patients per day. You cannot expect them not to be tired, not to be fatigued, not to be upset, frustrated, and especially, the most important part, not to make medical errors.
Yeah.
And this comes with a consequence that for me is the biggest one and the real reason of this connection in between moral injury and burnout. This comes with the feeling that you are failing yourself, that you are not doing what is aligned with your values, that you are going against what you promised, right? When you graduate from medical school or nursing school, I will help people, I will never harm. And you go night after night to sleep thinking, oh my gosh, what I am doing, what I am becoming. This does not reflect my heart. This does not reflect my soul. This does not reflect who I am as a person or as a professional. And that breaks you.
Yeah. Yeah. So let me ask you this, because moral injury, that's a way different way to put this. And my question is somewhat twofold. It's an observation and a question, but the way my brain works, it's very literal. And so it was always to me when somebody says, I want to help everyone, I'm like, well, who's included in everyone? And getting someone to realize that they're also included in everyone is just not normal. Like, they don't see it. And I know in all my studies of the brain and societies and stuff, we've been taught very skewed versions of selflessness and selfishness and stuff like that, right? So so with that, there's also the aspect of personal responsibility. And when I go into organizations, I have to weed through and meet people where they're at, where some people are in a stance of wanting to take personal responsibility for themselves, but they're also not sure how to do that. So they're blaming, right? So how are you, or I'm also saying this, how can we, as a society, reconcile the whole accountability and the responsibility aspect? Because ultimately, yes, these people get overworked, but when I've talked to some of them, they've had many, many moments where they said, I should have spoke up. I should speak up, right? But there's that fear there. So how do we reconcile that? What's your thought?
I love your comment, because I realized with the years that we have decided to become victims of the system. And so we blame the system. And that's the easy way to go. When you ask the same physicians, nurses, and etc. About why they are not complaining, the answer is fear. I have fear of retaliation. I have a debt of $400,000 from medical school that I have to pay. And if I lose this job, what happened with me? I cannot ask for help from a psychiatrist or a psychologist because I am obligated to share that information when I apply to my medical license, or to a job, something that doesn't happen to other type of professionals. So I may not be able to practice anymore. And if you think about those things, majority of physicians, especially physicians, nurses, I believe that they are more outspoken, but physicians, we are very afraid of saying that, because the answer that we get from our bosses or even from patients, because we are actually victimized by patients too, is, but you are the doctor, you have an obligation, you promise that you will save our lives. So it comes to, our feeling of guilt and our concept of we are supposed to be altruistic, we are supposed to save everyone. Everyone does not include us. Right. Nobody in medical school told us that we are supposed to eat, pee, sleep, have a family or whatever. Oh, the opposite. Patient first, patient first, patient first. And I promise, I was very proud of not sleeping for days, using the same clothes, eating chocolate and coffee for days, right? and having an extra clothes and a pillow in my car, and sleeping in my car like a homeless here and there, because it was not worth it to drive back home. And I was super proud. I was like, yay, I am a good doctor.
Wow. So there's a gap there that needs to be shifted. It sounds like you're doing that in the work you're doing. Basically, even in the way I introduced you, looking at the aspects of burnout and looking at the aspects of mental health and well-being and those definitions. Now, I'd like to move into, just for time's sake, I'm curious about the 3C cycle of life method.
3G cycle. Yes, the 3G cycle was created as a tantrum, a very, very difficult moment of my life when I was going through this transition, thinking about quitting my job and, fighting the system. And I had the opportunity to join a group that was at that point created by Georgetown University. Manuscript is the name that it has right now, to write a book. It was kind of a grant. And my goal was to destroy the healthcare system. It's like, I will tell everyone what's going on and why we are so burnout, etc., why things are not working. But what happened during the process is that this ended being kind of psychotherapy. I started to recover hope. I met more than 30 amazing individuals that are now part of the book, and that they told me their stories of success after being confronted by challenges, different levels of challenges, from cancer to family problems or losing someone by suicide, etc. And they gave me also kind of the magic tricks that they use. And what I did is to back up that with science, because the science of kindness and the science of well-being exists. And I truly believe that giving knowledge is giving power to others. So the tricky cycle reflects my way to live my life and to be so resilient as I am. And it starts with setting goals. I believe that my first G is, if you know what you want, if you have a dream, if you have a goal, you will, start the process of pursuing something. And when you are in that journey, you need grit, which is the second G, right? This energy, this fuel inside of you that keeps you moving to get the goal that you want. But what happens is that you have catalysts in life, right? Some of them, they are very good, right? You have good friends, you have money, you look beautiful, whatever it is, and life goes fast and in the right direction. And you have sometimes catalysts that are negative and that actually may stop you or may delay the process, right? Fear, imposter syndrome, any disease, any disability, being poor maybe, right? The question is what happened at the end. And sometimes you will be able to get your goal and your dream will become true. Sometimes it will not. The question is, what do you do with that? And I believe that if you have an open mind and an open heart, and that if you pay attention, what will happen is that even when you go through the challenges, even when you don't acquire what you were dreaming with, you can always learn something. And if you learn something, you will always grow. And that's my third G, the goal, grit, grow.
I love that. Very cool. That totally makes sense. Now, the other thing I wrote down that I'm curious on your take on, and I'll give a little runway. Like I didn't realize it back then, but I started meditating when I was 15 years old. And it was literally on a tour bus, and I wanted to sleep, and everybody was loud, so I pictured myself transparent, and the sounds flowing through me, right? And then I was like, years later, as I really learned the different traditional forms of meditation. I know that in my time working with people now, I've gotten to the point where just meditation is just being in a flow state. Like I'm in a state of meditation right now. I'm very present. I'm very with you, right? You know what I mean? But how are you taking those two concepts? Because to a lot of people listening, they're just concepts of mindfulness and meditation, and bringing that into your work with creating well-being and whatnot for people.
I believe that we have been neglected in medicine and in life, many things that give us power. And one of them includes being able to control our own feelings, our own body, right? And to be aware of who we are, where we are, what are we feeling, what are we doing. And that's, in short terms, you use mindfulness for that, right? That's exactly what mindfulness is. And meditation probably is a word that makes it more fancy and more professional in some level, but it's actually an extension of what mindfulness is. And I believe that we cannot know ourselves and we cannot help ourselves if we don't proactively involve in mindfulness, right? In recognizing where we are and being present and understanding what is happening with us. And I am not a person that meditates, not continuously. I have, like, if I want to sleep, I am having a trouble, I will pay attention to that and I will do it. But I do mindfulness activities very often during my day. I incorporate them in an easy way, because the truth is that if you cannot use it, it's not valid, right? So there are so many ways that we can practice mindfulness. It's nothing that you need to have a master degree for that. You can just learn and incorporate it in seconds here and there in your life, and help yourself to heal, right? And to at least recognize red flags and to know when it's time to ask for help and when your body is not okay. And I believe that we need to do it more. Medicine is not just about giving pills to people. Medicine is also about preventing and realizing when are we okay and when we cannot heal ourselves.
I love that you brought the last thing you said. It's not just about medicine. And I've worked on that narrative and teaching people that narrative for probably a good 25 years. And I remember back in the beginning days when I was talking about these things, and I worked with a lady about 10 years ago. I'm bad with time, but named Louise Hay, and her and I worked and did workshops with people to understand the mind and the body connection and stuff. And I love that you said that, and I want to really point out for everybody listening, because I want them to go back and listen with this in context. You are a medical doctor in 3 different areas, and we didn't really talk about doctor things. We talked about life. We talked about literally, my word was flow. We talked about different versions of burnout and well-being. We didn't talk about necessarily just putting a Band-Aid on it with a medication. We talked about the reasons why people reach those those levels. And I think that is probably the most valuable thing that I got from the call from you, that inspired me the most. Because the beauty of that is these conversations that we had, maybe we could probably go a little bit deeper than some people, but these conversations are happening more and more often now. And I love that, to where 20 years ago, there was no such thing as a lifestyle disease. And now when you talk to, almost everything is, you know what I mean? So it's really interesting, and it's been really inspiring to hear your perspective on this. Now, in this last minute we have here, is there one final thing that you would share, that you could only share one more thing, or final thought, or whatever arises is perfect?
I believe that I want to reinforce what you said right now is medicine has been focused on the body, right? And the liver that is sick, the kidney that is sick. We are more than parts of the body. We are not just organs. We are human beings. And we cannot be treated based on numbers of a laboratory or an X-ray. We cannot be removed from our social, emotional, even spiritual aspects. I cannot be a good doctor if I prescribe something that you cannot pay because you don't have the money, that you will not take because for religious reasons you cannot, put it in your body. And I cannot try to treat your pain when I ignore your depression or your loneliness. So it's time for us to pay attention to the human that is in front of us. And we will discover that, yes, there are things that require a procedure, that require an injection, that require a pill, and that's okay. That's part of it. But there are many things that require the emotional support that the patients deserve. And 15 minutes that are the average time that a doctor has in a clinic or in the hospital to see patients is not enough to treat a human. Maybe a liver, but not a human.
Yes. Miriam, Dr. Z, thank you so much for joining me today and sharing your insights with everybody.
Thank you for inviting me. It's such a pleasure to be here.
A final thought I want to add, one, you can learn more about what we're doing over at Ovationz by going to ovationz.com. It's Ovationz with a Z. You can see Miriam over there with her profile. But I also want to really point out, my final thought for you is that my definition of congruency and integrity is when we say and we think and what we do is the exact same message to the world. And everything you said shows that. You're speaking from your own experience. You've grown through your own experience. You've had goals. You've had to go through the grit, and you've gotten the growth, right? And I think that's really important to understand. And there was a lot of structural integrity into everything you said. So I want to acknowledge and give gratitude for that, because you're doing something amazing in the world. I'm so honored to be able to help showcase that.
Thank you. And you added the 4G, gratitude, right?
There you go. I added the 4G. All right. Well, everybody, thank you for joining us for another episode of Insights with Ovationz. We'll see you the next time.